the journal has had this leadership role over the last period of time, in part, I think, because of its excellent editors that it's had, in part because of its association with EHP. I think in part because it was the first serious journal maybe in this that was dedicated to the environmental health sciences writ large. What do you think we need to do to keep that area of leadership as we go forward?
NIHS is not like some of the other NIH institutes. Cancer is dealing with a single disease. Other institutes deal with single organs. We deal with all diseases, and we deal with all organs, whether it be the lung, kidney, immune system, neurological system, liver, intestine. We deal with the reproduction and developmental toxicity and so forth. And we deal with the whole thing. And I think it's important for the a journal to continue to reflect that and to cover those many areas that span the interest of the Institute and not drift in too heavily into one particular area or another. And that just takes, I guess, some monitoring, and it takes some emphasizing the fact that it is a broad-based journal and must be a broad-based journal to fully reflect the very broad issues that are relevant to environmental health.
Yeah, I think the editor has a big role here, as the public face of the journal, to reach out to the different disciplines, attending meetings, talking to associate editors, meeting with them. I found that a challenge because we had about 50 associate editors. And I think it's a little bit easier now with an improvement in technology such as the Zoom meeting rooms and so on, to kind of keep all the associate editors judging papers in a similar way that are aligned with the goals and mission of EHP, which is the goals and mission of NIEHS. And that's where I think the leadership of the editor is really key.
EHP was really carving out a new niche in the idea that environment and health was a focus that not only would an institute of NIH be working on, but a journal would be working on. Mm-hmm. We're now in a place where there's a lot of journals in this space now, publishing on trying to publish broadly on environmental health. What do you think sets EHP apart now?
One thing we really have gone for us is NIEHS. That association gives us added credibility because it's part of National Institutes of Health. But we have to maintain our independence, but at the same time, somehow take up take the added aura of being part of NIH.
The workload is not small because we do get a lot of papers in, and we try to send out to review about a little more than twice as many as we will publish ultimately. So it ends up just being a big number of editors required to handle it, and to have editors, I think, in all of the areas that we are trying to publish in. It's interesting to think about the fact that one of the strengths of the journal is that we can publish in this wide swath, and yet the submissions that we get are often many in some areas and few in others. So it's a challenge to try to publish both the best in all these fields, but also have a balance in what appears on the table of contents when it comes out every month. And I think it's a challenge. But we also need to make it clear to people that we're interested in seeing their work. And I know all of you guys worked well at that as well, but make sure that people know that they're even if they don't see a lot of things on their topic in the journal is still interested in seeing their good work if it's about the environmental health.